this week. And you continue to be so actually in a lot of the sessions we've had. The need for sustainable funding to key population remains very essential and critical, especially at these challenging times. And so, as an organization dedicated for funding, and more especially funding and supporting key population and LGBTQ organization, we thought to organize this session to brainstorm, to reflect on where we are as donors and how we can do better in terms of supporting the community. And that's why this session actually is taking place. We know so well that LGBTQ organizations face surmountable obstacles in receiving and using funds, especially for HIV response. We equally know that very little money is actually flowing through the LGBTQ and key population ecosystem. And that is actually made worse this year by the US funding situation. And so this session, we brought in some panelists, and we literally still waiting for UNA to join the panel to actually share their thought and perspective on how their organization is actually navigating the challenges to provide the community with funding, as well as their perspective on how we could do better in terms of reaching out to the community. I will let them introduce themselves actually before we kick off with some of the reflection for the session.
Good morning, everyone. My name is Sean Mellows, the Director of Strategic Partnerships and Advocacy at ViV Healthcare.
Good morning, everyone. I'm Dr. Pasquin Ogunsoya. I work with Alive Medical Services in Uganda as the Executive Director.
Good morning, everyone. My name is Farai Mavunga. I work for WHO in the Department for HIV, tuberculosis, hepatitis, and STIs. As you probably know, these two departments have now been merged. In this new department, I had a unit that focuses on, and this is across all the 4 disease areas that we work in. We focus on people-centered services, key populations, and comorbidities.
Thank you so much. Thank you. I will start with the very first question for reflection for today's session. And essentially, as we said, and as I said earlier on, the need for funding to the community has never been critical than now. And we know that some of us, the donor community, are doing their best to respond. We equally know that despite their responses, challenges and key challenges still remains. But this year, it was more critical with some of the drastic cuts on funding for key population and LGBTQ. I want to start by asking the panel, and 3 of you actually, what are you doing differently in response to the funding cut, especially what the organization is doing to meet the needs of the community? Sean.
Big question, and a difficult first question, because I think that the funding impact post-20 January has had an impact on communities that we don't yet fully understand. And I think we will probably only begin to understand that in a couple of months' time. But from ViV Healthcare's perspective, we provide funding through 2 different channels. The one is through our Positive Action Program, and the other is through Government Affairs and Global Public Health. The Positive Action Program immediately jumped into action, no pun intended, but tried to ensure flexibility around funding to their existing partners. So ensuring that they were able to adjust budgets to help them respond to the crisis. We also created an emergency response fund where existing partners could apply to allow for that continuation to happen. And we also try to connect partners to other organizations that we knew who were involved in a rapid response fund. For example, Frontline AIDS has got a key population rapid response fund. So any partners who immediately required that emergency funding, if we weren't able to help, we referred them to other partners. I think moving forward, it is about us becoming more intentional in our funding, particularly when we talk about investing in KP-led programming. We need to make sure that the organizations are truly KP-led and that they aren't just organizations focusing on key populations, but that they are led by key populations and they are governed by key populations. And I think it's also important that we find creative ways of making our application process less cumbersome and less burdensome. Easier. I think often grantees struggle with the amount of information that we require from them. Situational analysis, country context, and so are we able to use AI to help simplify the application form so a lot of those questions which take a lot of time can automatically be answered, but the program focus and program deliverables is where the grantee focuses a lot of their time and their investment on.
Thank you so much, Sean, for that reflection. I just want to welcome UNAID representative, but I know she will have time to introduce herself and UNAID. The next question to Dr. Pasquin. Dr. Pasquin, I know AMS actually is a service provider in Uganda and does things differently from the donors who are in the panel. Can you just maybe briefly explain how AMS have been responding to the current funding challenges? Thank you.
Thank you, Mr. Columbus. What has kept Alive Medical Services going is resilience, innovation, and community strength. But of course, resilience alone cannot sustain health systems. So what we had to do was to reorganize and reprioritize services. We had to close night duty. We used to work 24/7. We had to close night duties and prioritize day care, life-saving services. So we had to continue with multi-month drug refill. We had to multitask, task shifting, and we also had to do a lot of virtual services. We've also been using peer support and volunteers a lot. When funding reduced, we had to inform them that funding is not available. But the community, being very resilient, agreed to volunteer. But we also know volunteering is not sustainable. So we had to reduce on some programs. But apart from that, we also aggressively started looking for new partners and strengthening all partnerships and diversifying funding, looking for community to take charge, local leaders to work with us, and also looking for organizations that are similar, doing similar things so that we can share responsibilities. So that's how we have so far managed. But of course, all these innovations are temporary. We still need partners to really put funds together to sustain these services. Thank you.
Indeed, thank you, Dr. Pasquin. And that's why some of the donors are in the room, and hopefully they are listening. Can I turn to Dr. Ferrer from WHO? Just some perspective, how WHO has been responding since the beginning of this year.
Okay, thank you, Columbus. As you probably know, WHO is a member states-driven organization. We do get a lot of our funding coming from member states, but in addition to that, a significant proportion of the funding also comes from donors through the so-called voluntary contributions. So for that reason, WHO was affected as an organization. So our actions in response are really in two broad categories. There are internal WHO actions to address funding to WHO, but there are also actions by WHO to support countries in the context of reduced funding. So in terms of the internal processes, I think many of you would be probably aware that WHO has gone through a reorganization and realignment exercise, which in essence required us to reprioritize our work, focusing primarily on those functions that only WHO can perform, or where WHO has the best strategic advantage to perform. So that was done, and that process was used to then inform the revised structure for the organization, which unfortunately, of course, resulted in a reduction in the staff count in WHO across all the levels. This is at headquarters, at regional level, and at country level. And at headquarters, I think for many of you again would know that the departments, we used to have two different departments, one focusing on TB and lung health, and another one focusing on HIV, hepatitis, and STIs. Now those two departments have been merged into one to address the 4 disease areas. And I think in many of the regions and country offices, there are also variable degrees of merge of these functions with respective officers. So that process is almost complete, and it has resulted in a reduction in staff count, and of course it has also resulted in us reprioritizing what we focus on. And then in terms of our support to countries briefly, we have also been involved in trying to support countries to respond to this change in funding landscape through providing guidance on prioritization. I think there was a recent one, especially focusing on HIV, hepatitis, and STIs, where the key message is being that as we prioritize, we should ensure that this prioritization is driven by data, is driven by needs, but also is equity-oriented. Because quite often when we have to prioritize, sometimes we go for the easiest, not the most needed. So it's really to try and ensure that that is built in, and also to support countries in monitoring the response and populations most affected, so that whatever prioritization happens addresses these populations. And I think this is particularly relevant in the case of key populations, where really the prioritization has to be data-driven, even in the context of reduced resources. Thank you.
Thank you so much, Dr. Farah. And you just mentioned prioritization, actually, you go for the easiest than the neediest. I think that's an important expression, and that's why the key population is a community is very concerned that their needs in that ecosystem is not always met. They are not literally part of the conversation, and quite often funding decision is top down without meeting the need. So we should come to that to the second question, but can I just ask WHO, please introduce yourself and how to introduce yourself and how UNAIDS is responding to the funding cut. Thank you.
Thank you so much and good morning. My name is Anne Githuku Shongwe. I'm UNAIDS Regional Director for Eastern Southern Africa. So let me share how we've been thinking about our support. And I think it's important to be clear, like WHO was saying, we're not a donor. We're, we're the UN, and we work as a secretariat. We work with joint programs with all our UN partners. That said, in terms of the actual funding, we have been approaching funding at 2 levels, maybe 3. The one is country level support directly to KP organizations to to support their work at the country level, and I'll give you a couple of examples. And then we have regional support, some of which we lead as UNAIDS secretariats, and some of which we lead collectively as several UN agencies. So first at the country level, and maybe I'll share specifically the example of Uganda. So in the case of Uganda, you're all aware of the Anti-Homosexuality Act, and during the Anti-Homosexuality Act process, we provided support for legal interventions in relation to the Anti-Homosexuality Act, mobilizing both, providing support both to KP organizations, but also to the legal fraternity, and we put ourselves out as UNAIDS, as amicus curiae for the case. So that's just an example of, direct support to the agenda of LGBTQ at the country level. But we followed that with support from one of our donors that enabled us to raise resources that are specific for the continuation of the work of KPs through the KP forums and local organizations, doing a combination of safeguarding, but also really trying to build strategies for how to expand partnerships in the country to protect and promote the work of KP organizations in the country. So I use that as an example for Uganda, but we've done that in a couple of other countries, in Tanzania, with different donors. And again, we've worked with other UN agencies on that work. So that's the one level. We have developed an emergency fund, and we've recently been able to raise more money from one of our global donors to be able to provide emergency funding. And the emergency funding is important because when we've had the level of pushback that we've been experiencing in the last couple of years against LGBTQ persons in our countries and key populations in general, we have created an emergency fund. It's really, really small, but at least it's a fund where necessary, we've been able to support the removal of KP persons, LGBTQ persons experiencing attacks from environments where they need to be moved. And we've sometimes within the country, sometimes outside of the country. And also emergency funding for convening, where groups are unable to meet and convene and plan in the country, to be able to sometimes move them to other countries to be able to convene there. So that's just really at the country level some of the support that we've been doing, and we've got a few examples in different countries. East Africa, of course, has been the most difficult, and that's where we focused most of our attention. Then at the regional level, we have a partnership that we call Together for SRHR with UNFPA, with UNICEF, with WHO. And in this partnership, we have an innovation fund that is specific to LGBTQ organizations. It's a new fund, but it is one that we are looking at pooling, increasing funding so that there is a regional pool. So we've put in the initial seed, but we're trying to grow it out so that we can mobilize more resources within this innovation fund to support. And some of you who might be in the room have been involved in shaping it, so it's not something that we shape sitting on our own. We've shaped it directly with LGBTQ organizations. And so that's another example, at least at the regional level. We also have a fund, a small pool, and I'm saying fund, it's not a lot of funding, but it is some funding. So it's catalytic funding, but we're trying to grow the pool. And this one is specific to LGBTQ organizations. And we've been meeting in the last few months. One big meeting in East Africa, another big meeting in Southern Africa, along with our partners, UN Women, OHCHR, and UNDP, UNFPA, working together to support media and journalism, and really trying to see how to support the messaging for LGBTQ organizations in particular. but also just how to organize around the pushback, because that's been a big issue. And it's been with LGBTQ organizations in particular. So just giving us sort of sense of what the pool, the different forms of funding that are happening in our region, I thought I would share that. And we can answer specific questions if we want to know, but it's really been in all these instances, we work very much with communities at the center of the programming and how the funding is done.
Thank you so much, UNA. Thank you. And it's really a pleasure and a delight to know the great work you're doing, especially in response to the funding crisis, and equally some of the regulatory work and the support you provide to governments and communities. We appreciate that. And we have a very good and important relationship with UNAID. And we understand the need for partnership is more than ever needed, especially at this moment. You mentioned the partnerships, some of the partnerships we have. And my next question, especially to the donors in the room, is about private-public partnership. And this is really essential. Now that traditional funding actually is not forthcoming, we want to see coalitionship, we want to see partnership that will ultimately increase funding to the key population and LGBTQ community. So I want to check, I'll start with you, maybe 2 minutes each because of time, so sorry. How can private partnership and philanthropic donors, including corporate entities, how can they better complement traditional donor funding? I know you already mentioned some of those, as a matter of fact, and you've discussed what you've done as UNAID, sorry.
Yeah. I mean, I think we have a foundation. With resource mobilization, you have to be able to have already established a baseline, a foundation that you show that you can raise the funding, you've already, built a track record. And so we are exploring consortium-based resource mobilization where, for example, Sean, we should talk because maybe there are ways to move together, but also other foundations. And so we have been in discussions with some foundations. We are not there yet, but we are in the midst, and we can't make any announcements until we have bedded it. But we are in discussions with some foundations where we have included especially young key populations as part of our proposals. But it's consortia-based, where there is more than us. There are the KP organizations really to be a part of the consortium. And I think this is the way to go going forward, because we've been able to see how effective it is, and we can show some of those results. The private sector itself, there is, of course, what's that business report called that looks at LGBT funding? It's early in the morning. I'll remember it. But there is... The GPP one? GPP? What's... Huh? It's not about AIDS. It's specific to LGBTQ funding.
Is GPP a global philanthropic project?
No, it's a different one. It will come. It will come while we're here. It's too early. But I think it's an important tool to use because it tracks. It's similar to a gender tool that is used for tracking women's funding. It's used to track. It's called not the other business, but I'll Google it. Maybe Open for Business. Maybe Open for Business. But I do think that it's the kind of partnership that we need to bring in, because they're already tracking how LGBTQ funding goes, or so what are the indicators within business. And so we haven't approached them yet, but we've been thinking about it and been sort of tracking the reports to see who within the network are open for business for LGBT funding, and see if we can bring those into the consortium. So we're doing the thinking. We're not there yet, but, we're also fighting our own battles, as you know. So while we're at it, we're fighting here, but we're fighting with you. So we continue, I think, strongly that way. Thanks.
Thank you. I think that was very interesting, especially the data for LGBTQ funding. Just to say, I think we're funding GPP, the Global Philanthropic Project, I think Viva as well, to do something similar to that. And I know Funders Consent for AIDS is doing something similar, but it is equally important at the moment for us to use data for funding and evidence in our program. I think that's what UNAID was just saying, and essentially critical. And I just want to pass on the microphone for Sean, maybe 2 minutes. What your perspective is about public-private partnership, especially how philanthropic donors and corporate entities can complement traditional funding.
Thanks, Columbus. I think in a way this conversation is potentially highlighting how there are gaps in the response to LGBTQ funding because so many different donors are doing the same thing. There are so many different reports by different donors on LGBT funding, who's funding what. So trying to ensure that the donors act more strategically. I do think that we need to coordinate better. For example, Vive with Elton John AIDS Foundation, understand what your priorities are, understand what our priorities are, ensure that there isn't duplication in those priorities because our funding envelopes have to go further, and therefore I think we need to be smarter in order to amplify that impact that LGBTQ organizations want. But I also think it's critically important that there is an element of co-creation together with KP-led organizations so that we understand what your needs are around HIV funding, and that those requests for proposals aren't developed at the global level because we think that's what you need, or we think this is how we're going to achieve our objectives, because that isn't needs-based. We need to understand that how your views and your priorities are integrated into our requests for proposals. Importantly, linked to my first point, I also think donors mustn't create what already exists. There were so many emergency funds set up after January the 20th. New emergency funds set up. But there are already so many well-run existing emergency funds that exist. Some of them are struggling to survive. And it is quite complicated to set up an emergency response fund. It isn't easy. It's quite resource intensive because you have to get the money out to the grantees as quickly as possible. So invest in those organizations who are already doing it and who have the capability. And my final point about us collaborating better together, particularly the private sector, sometimes can say things that others cannot say, particularly when we talk about prioritization and integration, and we know that in many contexts that means exclusion. And many of the agencies or the organizations are afraid to use certain terminology like inclusion, diversity, equity, and it's also an issue for us as a private company that we have become more sensitive about the language that we use and how we use it because of the potential political backlash. And so we do need to find ways in which we can amplify and champion key population issues at the country level and at the global level in an authentic way and really speak out loudly and proudly about the importance of key population.
Indeed, Sean. Thank you so much. That was very insightful. I will switch this time the question, Dr. Pasquin, essentially on the service provider aspect of it, and with reference to the community and the key population community, especially the LGBTQ, and those left behind in that ecosystem. So what's your assessment? How do you think how can donors ensure that the most marginalized groups actually are not left behind in funding? What's your experience actually as a service provider? And perhaps your relationship with donor and how that dynamics interplay. I'm sorry, because of time, I'll keep that for 3 minutes. Thank you.
Thank you, Mr. Columbus. That's a really good question for service providers. Just a brief background about Alive Medical Services. We are based in Uganda, and for the last over 19 years, we've provided uninterrupted services 24/7 to key populations. And we've kept our doors open, not even during Ebola, COVID-19, Mpox, and also the social hostility. Our doors have always been open because we believe that everyone has a right to health services. Now, talking about how we can ensure that funding mechanisms ensure that the most marginalized persons are not left behind. I think we should put the LGBTQ communities at the decision table. They should not just be a checkbox for consultation. They should be co-designers, co-governors, and leaders within funding mechanism. Secondly, I believe that both donors should fund LGBTQ-led groups and also allies dedicated to serving the LGBTQ communities. So, of course, giving LGBTQ funding directly is not a question because they are the ones that know what is needed. But also, I believe allies, there are some allies that really serve LGBTQ communities, especially in countries where there's criminalization. They will need support. So they should fund allies that have national reach, that have clinical infrastructure, confidentiality systems, and that have legal mandate to serve and are deeply rooted in the community and have their trust. And then also I believe there should be pathways of serving small groups because the small groups are the ones in the community, interfacing with LGBTQ persons in communities, in villages, in the rural areas. So they should also be funded. And also, they should fund intersectional and integrated service models, not HIV alone, SRHR, mental health, psychosocial support, legal aid, and harm reduction, and all services integrated together. And I also think that the funding should be long-term, not like 6 months. When you're just beginning to get the trust of the community, the funding has ended. So that's what I think should be done. Thank you.
Thank you, Dr. Pasquin. Perhaps the same question to WHO. Actually, Dr. Farai, and you work as well in supporting governments and CSOs and other organizations and institutions to respond with equity, with fairness and inclusion, both at the policy and implementation phase. So how do you think donors can ensure that no one is left behind in their funding decision? Thank you.
Okay, thank you so much. I think from, of course, WHO's perspective, we have a normative function, which means that we develop guidelines, policies to support countries in service provision. As a starting point, I think the responsibility for health rests with the government. And I think everything else that is happening, I think we should ensure that government remains responsible, for the health of the citizenry. Now, in that regard, we should, any additional funding should be to complement. So I think the long-term vision in most, that we would like to see is increasing or progressive increase in country ownership of programs, because we have seen what can happen, if we rely too heavily on external funding. So I think whatever we are doing now, whatever donors are doing, for now, yes, the reality is that we need replacement funding because we don't have enough domestic funding. But I think the long-term goal should be to ensure that all these programs are funded through domestic financing. So we have issued earlier this year guidance on sustaining priority HIV, hepatitis, and STI interventions in a changing landscape. Again, the principles in this guidance are that, yes, we do not have enough money, but for that amount that we have, we should ensure that we address the needs of those most in need. Because again, sometimes when you go for quantity, you miss out particularly on the key and vulnerable populations. Because usually by definition, marginalized populations are a minority. So if you're going for the biggest numbers, you are likely to miss out on marginalized communities. So I think in this guidance, we emphasize that concept of equity, but also ensuring that we achieve access for those most vulnerable. And of course, that includes LGBTQ plus communities as well in this guidance. We also emphasize the provision of services through ethical, non-stigmatizing approaches, again, with a focus on equity. From a WHO perspective, again, I think the emphasis on data is important. We do know that most of the, about half of new HIV infections in 2024 were amongst, key populations and their partners. So again, being driven by data is important to ensure that the funding is directed to those populations where the need is greatest. I think community-based models of care have been shown to be effective in sustaining services, but we know that they are difficult to fund. So as we go ahead, I think, again, we need innovative approaches to ensure that we finance, we fund, we support community-led initiatives, community-led monitoring, again, to ensure that we continue to adapt our services to address the needs of those most affected. And I think the buzzword that I've heard in many sessions during this conference so far is integration. And I think, again, integration should be an avenue to improve services, not only an option for cutting costs. So I think as much as we're talking about integration, I know even in my own organization, sometimes being integration means that one person covers 15 programs, which may not be realistic. So again, integration should be designed so that it improves the services. Yes, it can cut costs, but I think the primary aim is to improve the services in a comprehensive manner for those who are most affected. So again, as WHO will continue to support these processes going forward, both supporting the health system side, but also supporting the community side, so that these two can meet halfway in being equal partners in the provision of services. Thank you.
Thank you so much, Dr. Farah and the panel. I just want to switch this time to the audience. We have 5 minutes for questions and comments. Please keep your questions short and comments as well. So,
hi, good morning. My name is Inad Quinones Randon. I am with the Global Network of People Living with HIV. Thank you to the panel. It's been inspiring and informative early in the morning. My first question is, when we talk about supporting community-based models, supporting about HIV, LGBTQ, and key populations, my question is, where are they in the panel? Why don't I see community in the panel? Second is maybe a feedback and comment. When we talk about new models for HIV response, beyond legal enabling environment, 2025 has given us a different picture, because we're not looking only at the legal environments, we're looking at the political demography of a particular country, of a region. the anti-gender rhetoric, anti-DEI rhetoric, the decreasing civic spaces for the civil society, and the further exclusion of LGBTQI, key populations, and PLHIV in the decision-making processes. Like from the panel, how are we looking in addressing this political demography beyond legal and enabling environment? Conservatism, authoritarianism.
Thank you. Maybe we'll take a set of three. Perhaps, I'm sorry, we can only accommodate 3 or 4 because of time constraint. But please feel free to, I think there'll be an email which we can always provide for you to forward your questions. We don't mind to share them with the panelists, and then we'll get back to you on the response. But your opinion, your comments, and your suggestions really matters. Thank you.
I think my question is about how do we leverage digital tools to actually support, all these key populations, especially in terms of programming. What are your experiences so far? Because, we're in an age of technology-driven, healthcare or programming. What are we doing, actually, in terms of technology usage?
Hello, everybody. Thank you so much. I work for an organization known as Global Black Gay Men Connect. And part of the work that we did was when there was funding cuts, we did a study across community organizations to see that impact. And then we worked with community organizations to come up with plans there were budgeted plans that had the cost of providing services to key populations in a space where there's little resources. But one of the things that we saw was that most of our organizations are primarily funded to provide activities. They do activity-based work. And yet we are talking about sustaining the key population program. So how do we move from funding things that are just activity-based to funding core support at community organizations so that then they're able to survive when the donor funding ends? Thank you.
Thank you. My name is Evaristo, and I'm from ADPP Angola, which is a member of the Federation of Human Poto People. I want to have some comments from UNAIDS and WHO, because when we are talking about future funding, and also to look at one of the critical barriers that our countries is facing, like Angola, which is the legal framework, our constitutions. So to put up like a sustainable funding, also we have to mobilize the domestic funding. But with present constitution and the legal framework that discriminates the LGBTQ plus community, it will be difficult to mobilize the domestic funds. But in terms of advocacy, what is the perspective of UNAIDS and WHO? Thank you very much.
Thank you. My name is Elizabeth Shoyemi from Nigeria, CPHI. My question goes directly to Dr. Pasquin. So where do you see the biggest gap between donors' expectations and communities' realities on ground? I'll give like an example. In Nigeria, we've been told, not to disaggregate, data by key populations anymore. So how do you manage that situation? And then to the WHO expert as well, when this data is not disaggregated by KP type, wouldn't this data be missed while, collating the data for global use? And then, you spoke about priorities, giving priorities to data that is driven, and of course, by key population. And when this data is missed, how do we do that? How do we prioritize? Thank you.
Okay, good morning. My name is Christian Onya. I work with Population Council, Nigeria. I post 20th January of course, we know that funding has been very tight. I want to ask for us to implement cost-effective and sustainable programs for KPs, especially LGBTQ community. What are the expectations of the funders, and what does the funders expect from us? Sean talked about the making the process very less cumbersome, while from WHO, he also talked about data-driven programs. So it's very important that we also have more expectations so that the relationship can be very effective and seamless while we are seeking for fundings. Thank you.
Thank you, Christian. And just to apologize that we no longer answer a question because of time. And trust me, we will literally provide emails in which you can submit your questions. We'll share them to the panel and get back to you. But your questions, your thoughts is equally very important to us. So I'll just ask the panel 2 minutes, please. Pick any of the questions you could, apparently from a series of questions, and within 2 minutes, please provide some answer. And then I invite my colleague and friend, Chris Kolo from FHI, to actually summarize the key catching message for this session, and then we can close. Thank you so much. Start with UN AIDS.
Thank you so much. Some really good questions. I think that the reason that we don't have communities sitting here in the panel is that the question was for funders to have the discussion about how we work with community-led organizations specifically. So I think, but they can answer. I'm an invited speaker. But anyway, just to say, I thought. But I think it's really important that you know that in the work that we do, communities that are, we work with communities at the center. So in all of the programs and design of the programs, we have worked with KP organizations specifically and LGBTQ organizations specifically. So we can always do better, but I think I just want you to rest assured that this is quite important and quite at the center. The issue of core funding of organizations is not uncommon, whether it is for LGBTQ organizations, girls' organizations, you know, generally funding, unfortunately, has not been, there are very few. Ford Foundation, for example, is one organization that has been providing increasingly core funding. Robert Carr, of course, were providing this kind of core funding to organizations, but they also, you know, lost quite a bit of funding. So we have to collectively, and the reason that we created this innovation fund is to try to start almost recreating, not a Robert Carr, but to create a fund that enables us to provide better core funding to organizations. But it is in general a problem that most funding that's available is program funding. It's activity-based funding because those are the way funders want to see their results. So we have to continually push back against that to be able to see how else to do this. I just wanted to talk about the funding for Angola. And just to say that, you know, in the sustainability roadmaps work that we've been doing, Angola is coming in the next round. We have been trying to center community-led funding, you know, community-led programs at the center of it and prevention work, but it's been difficult because, of course, it depends on where the government is sitting. And so the other funds that we're creating it really are to be able to help to support some of that advocacy work. And so we can have a discussion, because I'm responsible for Angola, to see how to make sure that Angola gets involved in the work that we're doing currently. And then finally on data, you know, the issue of disaggregation of data is such a big one. It is so important, and it is political. Data has always been political. And we, as you know, as UN AIDS, with the HIV data that we do, We've always had IBBS, which is a separate data gathering that we do, but we also support a lot of community-based data gathering, because you know better how to, especially in criminalized contexts, how to gather that data. So I think what we have to do is continually see collective data as the way to go, so that where government is controlling the data and closing those spaces, we have to continually keep looking for multiple sources of data, and AI should allow us to do even more and more now. But I acknowledge that it's a challenging situation because data is political.
I'll respond to two questions, Columbus, and the first one is in response to Inad's second question about the broader anti-rights, anti-gender movement. And I don't think that the collective we learn our lessons, because I think after 20th of January, there was this surge and energy. What are we going to do? We have to fight back. We have to respond. That's completely died down almost now. But the anti-rights, anti-gender movement hasn't died down. They are continuing to do the work. They are continuing to send people from religious people from the US into African countries. And we need to get better at how we collectively strategize, collaborate, and fund the response to them. And I don't think we're doing well at all. In terms of data, so much of KP data was lost after the stop work order because PEPFAR set up parallel systems. So all that data is gone. But that's where digital tools becomes even more important, owned, controlled by key populations, obviously with all the safety and security systems in place. But we need to get smarter as to how we use digital tools to ensure that key populations are in control of their own data, collect their data, use their data, advocate with their own data. And we as donors need to get better as to how we use AI in our application processes and our application forms.
Thank you. I will answer the question that was directed to me, but also following what my colleague from UNAIDS said, data is very political. And in the context of criminalization, like Sean had said, when the stop work order came, we lost data. And of course, KP tracker was put down, so data was lost. So how are we managing this? We, of course, have also a parallel system, our own data source that we've been using to track, but we have also been advocating, working with the Ministry of Health, working with Uganda AIDS Commission to advocate that data is disaggregated, because without data, you cannot provide meaningful programming. You know, when you don't know, you cannot provide. So we've been advocating that data is important, but it's still political, it's difficult, but we're advocating and also being very careful in how we collect our data. Thank you.
Okay, thank you. I think just to comment on a few of the questions, I think the digital tools, I think that is, I agree, I think with the comments that have already been covered. And I think from our perspective, there are several areas where digital tools are proving to be beneficial. I think as mentioned, one of them is data. But we also use digital tools now to disseminate our guidelines from WHO. And other partners. So those are now available online. There are apps that are available for that dissemination with a view to improving access. Again, any other information sharing, I think it is now digital, it is available. But also there are various uses of digital tools now in improving service delivery, be it adherence support, be it ensuring that we map hotspots of where we need to respond. So there are various options that digital tools can support. But of course, mindful that digital tools are not available everywhere. So it is important to ensure that, as we move towards digital platforms, we are not, basically making marginalization worse for those populations that might not have access to our digital technologies. And then I think in terms of funding calls, work, for me, I think it comes back really to government ownership, because progressively, there should be, and I know there are countries that are going towards social contracting models to be able to finance, community-based organizations. So I think as we are getting funding from donors from various sources, I think in parallel we should be improving our mechanisms to ensure that community-based organizations can benefit from domestic financing, which I think is more sustainable. And I think, in terms of data, I think data is critical to addressing whatever problem you want to address. You need the data. But as I agree, it's highly political. And again, we've learned our lessons. So I think going forward, there's a lot of advocacy that is required to address this aspect. And then lastly, this is my own personal opinion, not WHO opinion. In terms of sustainability or, the political dynamic, the rhetoric, what is happening. I think in many countries or in different countries, you have to figure out what works, what language works, for your politicians. So you might have to find out within your local context, what are the entry points that are acceptable to the politicians, or who do they listen to, in order for you to get the message across. So I think a lot of this might need to be locally based, very customized approaches to reaching the political, hierarchy, because at the end of the day, a lot of these are political decisions. So that would be my own suggestion in that context. Thank you.
Thank you so much. I'm sorry we cannot take more pictures. I want to invite Chris, 5-minute Chris, for the key message, and then I'll wrap up. Thank you.
Yeah, thank you so much, Columbus. And I have a very difficult task of summarizing what our great panelists have all discussed. My name is Chris Akolo. I'm currently Senior Technical Director for HIV, FHI 360. I'm based in Washington, D.C. And I've had the opportunity of also working and supporting a lot of key population-led organizations globally to deliver services through funding from the U.S. government over the several years. So I think I've tried to just capture a few of the thoughts that came from our panelists, as well as from responses to some of the questions. We all agree that HIV responses for LGBTQI, key population communities, remain under financing models that prioritize access for all groups, community leadership, and long-term continuity. We need to push for policy reforms that protect all groups and enable effective HIV programming. And finally, we need to invest in innovation that keeps pace with the evolving HIV science and the changing realities of LGBTQ communities. Thank you so much. Back to you.
Thank you, Chris. What a superb job and a great summary. And that reflects the richness of this conversation, the insightful thought and perspective, and some of the ideas which we've gained as an organization. I think to us this is very useful, extremely very useful. We continue to engage with donors and others in this room to ensure that funding, the little funding now, they actually reach to those who need it most. And that's why we had this conversation. And we'll be very grateful with some of the ideas we've got. And we'll continue to have this conversation. And thank you so much for coming. Can I invite Chris to join us for a picture? And please, can you help me give a round of applause to the panelists? They've been very amazing. Thank you, panelists. Thank you so much.